Welcome to the Health, Balance, Wellness channel, your haven of peace. Today we talk about the kidneys, the most vital organs in the human body, responsible for many fundamental functions such as filtering toxins, regulating blood pressure, fluid balance, and producing certain hormones. However, despite their crucial importance for health, many people underestimate the conditions that can compromise their proper functioning. According to a 2020 editorial published in one of the most prestigious scientific journals dedicated to nephrology, there are numerous obstacles to the correct prevention and management of kidney disease. The authors underline how little knowledge there is on the subject, a certain inattention towards nutrition, and a lack of familiarity with the most recent scientific evidence. This leads to an often outdated approach to the treatment and prevention of kidney disorders, despite the fact that science has already provided rather clear and concrete indications. In this context, it is important to reiterate that any change in diet or lifestyle should never be improvised. It is essential to do so under medical supervision, especially when dealing with already diagnosed clinical conditions. For those who want to delve deeper, there are several scientific studies available that deal with this very topic. Some of these have been analyzed and represent an excellent basis to also bring to your doctor to discuss more modern and effective solutions to the management of kidney disease. Before continuing, I ask you for a like to support our work. Let's now look at some foods that can help keep your kidneys healthy. There are 9 in particular, recommended for their effectiveness and easily included in your daily diet. Blueberries. Blueberries are small fruits with enormous beneficial potential. Rich in anthocyanins and antioxidants, blueberries help prevent urinary tract infections and, thanks to the citric acid they contain, counteract the formation of kidney stones. The suggested amount to enjoy their benefits varies between 100 and 200 grams per day. Apple. The proverb that an apple a day keeps the doctor away is supported by science. Apples contain vitamin C, pectin, and quercetin, all of which support kidney health and reduce inflammatory processes. It is important to consume them with the peel, where many of the active substances are found. Cabbages, green and red. These vegetables, in addition to being tasty and versatile, contain beneficial phytonutrients, vitamin K, and fiber. They can be eaten raw, cooked or fermented, and lend themselves to many culinary preparations. Turmeric. Known for its anti-inflammatory and antioxidant properties, turmeric helps protect the kidneys from oxidative stress. It can be used in numerous recipes or added to herbal teas and drinks. Cucumbers. Composed of 95% water, cucumbers are ideal for maintaining good hydration. Their diuretic effect makes them useful for those with kidney problems, helping to eliminate toxins naturally. Garlic. It contains allicin, an active ingredient with anti-inflammatory and antihypertensive properties. Garlic can help reduce blood pressure and protect the kidneys, but it is important to know the correct way to consume it, in order to preserve its beneficial properties intact. Lemon. With its high content of vitamin C and citric acid, lemon can help prevent kidney stones and detoxify the body in general. Pears. Fruits rich in water and fiber, but with a low glycemic index. Pears are perfect for supporting kidney function, even in the presence of diabetes or hypertension. Watermelon. Composed almost entirely of water, watermelon is excellent for hydration and has a natural diuretic effect, useful for those who suffer from water retention or high blood pressure. After exploring these foods, it is important to reflect on another crucial aspect, the role of proteins, especially those of animal origin. Excessive and prolonged intake of animal proteins can have negative effects on the kidneys, especially in those who already suffer from kidney disease. Even common medications, analgesics, if used consistently over time, can contribute to the deterioration of kidney function. Many studies, including systematic reviews of the scientific literature, agree that reducing the amount of animal protein in the diet can slow or even reverse the progression of kidney disease. Red meat, dairy products, eggs, and even fish, if consumed in excess, increase the presence of easily assimilated phosphorus and compounds that can promote intestinal putrefaction, resulting in increased toxins in the blood. In contrast, studies show that phosphorus in plant-based foods is absorbed less efficiently, making it less harmful. Reducing protein intake by just 10 grams per day can already have a significant impact. Going from 80 to 70 grams per day, or from 70 to 60, can have the risk of serious kidney complications in the long term. In a controlled experiment, it was shown that limiting protein intake to about 0.6 grams per kilogram of body weight produced surprising results. After a period of 4 years, the group that had not changed their diet had a mortality rate of 25%, while in the group that had followed the dietary guidelines, the rate was less than 10%. An interesting case study documents the story of a 69-year-old man with type 2 diabetes and stage 3 chronic kidney disease. At his doctor's direction, he adopted a completely plant-based, whole food diet. He didn't need to count calories or limit portions, he could eat until he felt full. The results were immediate. After just a few days, insulin doses were reduced by 50%. Within a few weeks, a clear improvement in blood pressure and cholesterol levels was observed. But the most surprising data concerns the kidney's glomerular filtration capacity. From a progressive decline, it moved to a stable and significant recovery. After a few months, the parameters returned to normal, like those of a healthy person. In the first 4 months, the patient also lost about 22 kilograms. This case, while brilliant, should not be taken as representative of everyone. Each person has a unique situation. However, it teaches us 2 fundamental lessons. The first is that there is always room for improvement, and daily choices have a real impact on health. The second is that change, if well-oriented and supported by scientific evidence, can really make a difference. Finally, it is always advisable to deepen your health decisions by reading directly from scientific sources. There are lists and collections of specific articles that deal with the topic of kidney health and nutrition, useful for those who want to make informed decisions. Please remember that this video is for informational purposes only and should not replace your doctor. If you like our videos, please like and subscribe to the channel to support our work. See you in the next video.